Hi, good morning, Caden. My name is Carissa Benedict. I'm your invigilator for the OET speaking session on the 27th of February 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Caden Muller.
And what is your candidate number, please?
My candidate number is 250822019.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What would your colleagues say about you?
My colleagues would say, I am a skilled and experienced nurse. I have 10+ years of expertise in nursing. Some of the attributes I think will be used to describe me are hardworking, professional, a trustworthy team player.
Tell me about a time you were under a lot of pressure.
I was the most senior nurse in the unit. I had to not only handle my patient's assignment, but I also was to act as a resource to the other newer nurses on the unit. I had to make sure my time management was great, as well as my ability to drop everything and help someone else. I had to stay organized, otherwise, I would not have been able to assist others.
Why become a nurse?
There is an old adage that you need a doctor to diagnose you, but a nurse to save your life. We can all recall a time when a nurse was needed most. From a normal checkup in a doctor's office, to an emergency situation, and even an outbreak like COVID-19. Most people can think of a nurse who has played a significant role in their life at some point in time. To become a nurse is to become someone who improves and saves the lives of others. If you're looking for a career where you can put your desire to help others to excellent use, becoming a nurse is an excellent career path for you.
Describe a situation where you display teamwork.
In long-term care, the nurses often act as their own charge nurses, responsible for medication passes, wound care, admissions, and discharges. Your day can be hectic. There was this one day when my coworker, another nurse, was having a chaotic day. He had a resident fall, a new admission, a discharge, and a heavy med pass. On top of all of that, he still needed to finish his skilled Medicare charting. I saw he was struggling, and offered to complete his admission and start working on his discharge paperwork. He was so appreciative, and was able to finish up and actually leave work on time.
Tell me about a time you dealt with an unhappy patient or family member.
I once had a patient who had a new order for wound care. His responsible party did not like how I dressed his wound. She thought that I should have used a different type of dressing. To ease her concerns, I reassured her I was following the doctor's orders. In layman's terms, I then explained the treatment order to her, step by step, and asked if she had any questions. She let me know that she was unaware of the order change, and thanked me for taking the time to explain everything to her in a way she could understand. I apologized that the new orders were not related to her, and let her know that I was available if she had any more questions.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hello, Krissa. My name is Caitlin Muller. I'm one of the registered nurses working in this ward. Good morning.
Hello. Good morning.
Krissa, I am here to check how your condition is developing and responding to the treatment.
Okay.
Thus, I would have to monitor your wound, take temperature, pulse and blood pressure, and also check your intravenous drip.
All right.
Krissa, at first, I would like to know how you are doing right now.
I have been feeling a bit feverish since I woke up today. And still, I am in a lot of pain.
Oh, I see. Try not to worry, Krissa. The fever and pain are the symptoms of your condition osteomyelitis.
Okay.
You have been administering IV antibiotics. The reduction in fever is due to the effect of antibiotics.
All right.
By the way, I would like to get more details about the pain. It will be great if you can share what you feel about the change in level of pain.
The pain isn't any better, or worse than it was before.
I am sorry to hear that. By the way, do you have pain in any other location, or any new pain experience?
Nurse, I really don't understand why you are asking about the changes in pain.
Your thoughts are really sensible. I will explain the reasons for exploring changes in pain.
That will be great.
First of all, it is a very important part in the monitoring of your condition. The importance of monitoring is to analyze how well the treatment procedures are doing on your condition. Also, to check whether there is a possible sign of secondary infection. Am I clear to you?
Yes, nurse. Definitely.
Krissa, I advise you to communicate with us if there are any changes in pain.
Of course, I will communicate with you.
Well, Krissa, do you have any concerns to be clarified?
Yes, nurse. I need some clarifications.
No worries, Krissa. I'm here to clarify your concerns. You may please proceed.
Nurse, I am not very clear why I can't take antibiotic tablets instead of the drip.
IV drip is more effective in this stage, and once your infection is under control, we can switch you to oral antibiotics. Am I clear?
Yes, nurse. And when I can go home?
Your question is really understandable. However, I would like to make you aware about a few things before answering your question. I request your cooperation, please.
Sure, nurse. I will listen to you. You may please proceed.
Thank you, Krissa. There are different treatment stages before the discharge. I'll explain it to you.
Oh, okay.
First stage of the treatment focuses on controlling infection.
Yes, I understand that.
Followed by stabilizing your health condition. As I mentioned before, we can change IV antibiotics to oral antibiotics.
I am much awaited for the stage.
All right. Next being the stage before the discharge. It will be initiated by establishing a self-medication routine.
Oh, okay.
These are the stages you have to go through before the discharge.
All right.
Krissa, currently, you are in the first stage. And your health needs to be improved.
All right, nurse. I understand that. And it was a really good explanation, nurse. Thank you.
Good to hear that, Krissa.
Nurse, how long would I have to take antibiotics?
Krissa, talking about your antibiotics, several more days, you will be given intravenously in the hospital, and about 4 to 6 weeks, you have to take the antibiotics in tablet form at home.
Okay, nurse. I will follow the instructions.
That's great to hear. Now, Krissa, can I have your consent to begin the required clinical checks?
Sure, of course. You may please do all the checks required.
Thank you for the consent.
That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.